Welcome, Rachel Jeffrey, to the Physician Assistant Forum. Thank you for accepting the interview.
Thanks for having me.
The main goal of Physician Assistant Forum is to bring some highlight to the PA profession, talk about some of the nuances of how to become a PA, and help the audience, get a more informed decision-making process, and help them in the application process as well, and figure out why they want to become a PA by talking to people like you who made the transition. I know you already a seasoned PA now, and you had a career before this, but just to help the audience understand, let's start from the beginning.
Okay.
What was your undergrad, and what were you doing before applying to PA school?
So I went to the University of San Diego for undergrad and majored in psychology and Spanish. And then during my time in undergrad, I shadowed a family friend who was a speech-language pathologist, and she worked in the neo-natal intensive care unit doing feeding therapy, and I thought that was so exciting. So I ended up going on to study and become a speech-language pathologist by getting my master's in that at Arizona State University.
Okay. So you had a master's degree in speech-language pathology, and you worked as a speech-language pathologist.
Yes.
How long did you work?
I worked for about 4 years.
Okay.
In the Banner Health System in Arizona.
Okay. A graduate degree, a career as a healthcare professional. What made you think that, you know what, I'm going to do this all over again and be a glutton for punishment?
Yeah, because I'm crazy. No, I think so my role as a speech-language pathologist was working in the neonatal intensive care unit and the pediatric intensive care unit, doing feeding and swallowing therapy with very fragile, sick kids, a lot of them with trachs and vents, a lot of cleft palate feeding, things like that. And I kind of hit the peak of what you could do medically in that role. And I just was so drawn to more medicine. I wanted to do more than was part of the role as a speech-language pathologist.
Okay. So you decided to become a physician assistant. Mm-hmm. Were you exposed to the career, or were you exposed to PAs working with you in the setting where you were a speech-language pathologist? How did this all come about?
So my future brother-in-law was a physician assistant who worked in emergency medicine. So I think my initial introduction was getting to come home and hear his stories from work, which were crazy and exciting, and he was doing all sorts of procedures and taking care of all sorts of conditions, and I just thought, I want to know more about this. So that's when I started to look into shadowing some PAs around the hospital.
How long did you shadow PAs before you decided, okay, this is a career for me?
I ended up doing several days of shadowing on my days off from work as a speech-language pathologist. And so at that point I was like, you know what, I'm gonna start this process and see where it takes me. Okay.
Did you have all your prerequisites done from your courses carried over from speech-language pathologist, or did you have to do more courses to even apply to PA school?
I had to take more classes, so that was sort of the hard part. I ended up starting with just one community college chemistry class, and I kept saying to myself, if I pass, if I do okay, then we'll just see where this goes. And then I ended up taking maybe a year's worth of classes while I was working, just to catch up on my prereqs, and then I had to take the GRE for a second time because my GRE had aged out.
Oh, for your speech-language pathology.
Yeah.
So, yeah, that takes a lot of discipline for somebody to go back to school after a graduate program, after having a career. So you must have been really driven and wanted to become a PA.
I think things just kept plugging away, and before I knew it, I was signing up for the GRE again, and I'm like, what am I doing? But by that point, I was pretty invested.
What aspects of physician assistant, in their job scope, propelled you to become, I want to do this?
I think the breadth of what you could do. I think it seemed limitless, that you could work in all sorts of different fields, and I initially was really drawn to the idea of gastroenterology or ear, nose, and throat, or neurology, things like that, just based
all
on...
All related to your speech-language pathology.
Correct.
Exposure.
Yeah, and so just the fact that you could do so many things, and then again seeing my brother-in-law working in the ER, and then I had a couple other friends who did all sorts of other different things. So it was, as a PA, so it was just exciting to know that there seemed to be so much out there that you could do.
So the breadth of the profession, the specialties you can work on, and the flexibility that you can move from one profession to one specialty to another specialty among the PA profession itself
Yeah.
is a very appealing factor for many other PAs applying to the program.
Mm-hmm.
It certainly seems the case with you as well.
Yeah, it was. I thought that was great.
So once you've decided, and once you started taking your prerequisites and plugging away, as you said, how many PA programs did you apply to? How many did you get interviewed in, and which program did you eventually accept?
So I ended up applying initially through the CASPA process to 6 schools.
And CASPA is the centralized application process.
Yes, and that was financially kind of where I hit my max. And then I ended up withdrawing my application from 2 schools just for a variety of reasons. And then I ended up sending formal final applications to 4 schools. I interviewed with 3 and then was accepted to 2.
What are the 2 programs you were accepted into?
I was accepted to Northern Arizona State University and the Duke PA program.
And which program did you finally decide to go into?
I went to the Duke program.
Why did you decide on Duke?
I think, so when I first applied, it was sort of a shot in the dark, just like, I'll never get into the #1 program, I'm just going to apply and see what happens. And then I got an interview, and I think they had a really strong interview process the year that I went through, in that they included my fiance at the time came with me, and there was a portion of the interview that included him, and then just the program itself had such a strong presentation during the interview process that, even my husband walked away and was like, if you get in, you really need to consider this, because I had already accepted a position at NAU, or Northern Arizona State.
Okay. So you were engaged at this time when you were applying to PA school.
Mm-hmm.
And your fiance at the time knew you as a working speech language pathologist.
Mm-hmm.
He didn't say, Rachel, you're crazy. we are starting a life and you want to go back to PA school?
I think by the time we were engaged, I was already in the application process, so that I think he knew that was part of what came with the package. He also was a pediatric nurse, and he was in school to be a nurse practitioner. So.
Okay. So he was very supportive as well. He seems like a cool guy.
He's not bad.
Can you explain the interview process itself? I know you kind of touched upon it, and what questions did they ask?
So the interviews seem to include a couple one-on-ones with different professors at the program. There always seems to be some sort of group interview component, and then the ones that I went to, the programs themselves sort of presented their program to you, because again, it's about making a fit. And so I think one of the main questions I remember specifically was what was an instance in healthcare that you felt like you really made a difference. And for me, it was working with a family who had a baby who had trisomy 18 or Edwards syndrome, and they don't have a very long lifespan, and this baby couldn't swallow safely, and so, but mom, all she wanted to do was feed her baby. And so the fact that we were able to put together a scenario that was safe and mom could 5 minutes just give the baby a bottle was, and just her face and the tears and everything, and I just, the fact that we could give her a moment in an otherwise really sad situation, sort of, to me, showed how multifaceted healthcare was. And so that question I remember answering and thinking, oh, this might have helped. This was a good one.
So now you're in PA school. You have the comfort of 9 to 5, working as a speech language pathologist, a paycheck.
Yeah.
And now you're in PA school. So talk to me about life in PA school. How many students were in class? How many came with prior healthcare experience? And how many came directly from as an undergrad?
So I think my program had 90 students. it did seem like the majority did come with experience. So, and also a variety of jobs. A lot of, there was a construction worker, there was a woman who was previously a lawyer. It was a really interesting mix of people who had a lot to offer from their prior backgrounds. And I would say the small minority were coming straight from undergrad.
I think that's one of the hallmark of a PA profession, that it attracts diverse people into the profession. In my class, I had 2 architects, and I had a couple of nurses, exercise physiologists, and some people are not in medicine at all, nothing related to medicine. Because usually you hear stories about pre-meds or biology majors, or somebody like you who had a healthcare job already. I was a physical therapist, but it does attract people from all walks of life.
Right.
All you have to do is take the prerequisites, and then you can apply as soon as you're eligible after the prerequisites. I think that's one of the most attractive features of becoming a PA.
And I think you get really well-rounded people from that. People who have other experience to offer and bring to the table.
Interesting. What was your didactic year like? I mean, you already had a lot of, as a speech language pathologist, you had classes in anatomy, physiology, I assume. How was your first year like? What was your most difficult subjects, or what challenges you faced in your first year?
I think for me, the transition back to full-time student was hardest, because at the point where I was coming home from work and getting to, my time was my time, and I didn't have to study all on the weekends, and I got to enjoy my social life. I think that it was a dramatic change to go back and start kind of like a student all over again. I also think that not all master's programs are created equal. I think that I thought I was coming in and I'd already had a master's, and I could do this. And PA school is rigorous, and because the information that you're getting is so compact and there's so much of it, and so it is truly like drinking from a fire hose. And so I don't think necessarily a subject stood out as being challenging, but just the lifestyle change that it was, and the amount that you're learning in such a short time frame.
Yeah, I always hear general public think, why didn't you become a doctor? Why did you become a PA? Some people think that PA is MD light, or they think we take an easier route. But like you said, PA school is tough. Mm-hmm. It's not an easier route. It is short, but it's very intense and very tough. And the analogy, like you said, drinking from a fire hose, that's pretty much thrown out everywhere. When I interviewed for a PA program after being a physical therapist, that's what was told to me as well.
Yeah.
PA program is hard. It is like putting a fire hose in your mouth and turning it full blast.
Yeah.
It looks like that experience holds true for whether you're a new grad coming out of undergrad or somebody with vast healthcare experience. Mm-hmm. Okay. What was your second year like, your clinical year, when you went out to?
Clinical year for me was a little bit better, I think, just in that I got to get my hands dirty, so to speak. Like, we got to try different areas of medicine and work in different services in different areas, and it just was exciting to go to different hospitals and see what all was out there, and learn like, oh, this is really not for me, or like, oh, I would like to pursue more of this. So, in regards to different types of medicine.
I mean, all PA programs are different, but there's a general theme. You do internal medicine rotation, you do family medicine, you do a surgical rotation, psychiatry, cardiology, and stuff like that. But almost all programs have an elective component as well. What was your elective, and why did you pick that?
So I did 2 electives.
Duke offers 2 electives.
Offers 2 electives. My first was the pediatric intensive care unit.
Go back to the same old roots.
Yes, yeah. And so I wanted to see what that was like. And I enjoyed that. It was hard, and it was very eye-opening to do it from a provider perspective. And then my other elective was a global health elective where I went to Ecuador, and I cannot emphasize how neat of an opportunity it is. If anyone ever gets a global health opportunity, I think it's worth looking into to see how other healthcare systems work, and what other providers are doing, and it was so humbling to see. Some of the hospitals that we were working in had so much less than we do on a day-to-day basis as far as tech and machinery and whatnot, and they're providing this excellent care. I remember seeing an EKG machine that was little suction valves on a metal cone, and that was how they stuck it on as compared to like the fancy stickers we have, and it just was such a great opportunity. And then to use Spanish in that setting as well was a priority for me.
So you went to Ecuador for a month? Okay, that must have been a neat experience.
It was awesome.
Okay, Rachel, so now you've finished your didactic year, you've finished your clinical year, you graduated from PA school. What happens next?
Then you have to get certified to be a PA. You take a national exam, and you have to get licensure in the state that you're going to work.
Wait, even though you've taken multiple exams during all your didactic year, in your clinical year, I'm sure you have end-up rotation exams as well. Mm-hmm. And then you take a final exam in PA school to graduate from PA school. You're not ready to work yet.
You have to pass an exam that essentially allows you to be a certified PA. It's that C at the end of PAC, so you're certified as opposed to a student.
And this is a national certification exam.
Correct.
Was it hard?
Yeah.
You felt prepared after graduating from PA school, or you have to study all over again?
So I took about 2 weeks after graduation and set out a timeline of the topics that were part of the exam, and I studied based on a schedule for that, and then took the exam about 2 weeks after that. So for me, I felt prepared, but I didn't want to get so far away from school that I started to lose my knowledge base. So I did feel prepared, and I had a couple of resources to use for preparation.
How important were these internships, your clinical rotations, shaping your career as a PA? Were there any specific experience that propelled you to a particular field after you graduated to find your dream job?
I think that the general relationship that I saw PAs have with their attending physicians was a huge part of what drew me to my different areas of choice. I think that was one of the things that was really important for me when I was looking into jobs. And then I think I had a very good rotation in emergency medicine, and so that was my first career as a PA, and that was helpful in guiding me that direction.
Your brother-in-law didn't have any influence in...
He might have had a little bit.
Because he was an ER PA.
He still is, yeah.
Oh, he still is?
Yeah.
So after graduation and after you took your national certification exam, you got a job as a PA in the emergency medicine. Where did you work as an ER?
I worked at Wake Med in North Carolina.
Okay. And how long were you a PA in the ER?
2 years.
2 years. And now, what? So you're not an ER PA anymore?
No,
Okay.
I learned fairly quickly that that was not the correct area of medicine for me. I think I like to say that ER is chaos, and I wanted some controlled chaos in that I like hospital medicine, I like acuity, and so I ended up looking into different specialties that I could maybe find that would be a better fit. And I wound up in neurosurgery.
So you're a neurosurgical PA now. And how long have you been a neurosurgical PA?
5 years.
5 years. And where do you work as a neurosurgical PA?
At Duke.
At Duke. So you've come back to Duke as a full circle.
Uh-huh.
You've been a PA for how many years now? Total?
So 8 now. I'm in the middle of my recertification, which happens every 10 years, so I'm doing it now.
Okay. So talk to me about your experience as a PA for the last 6 years. Specifically, let's stick with the neurosurgical PA. Because people know what they do in the ER, but a lot of people are not familiar with what PAs do in a surgical specialty. So what do PAs do in neurosurgery?
So my role specifically is not in the operating room, which was ideal for me. I love procedures, but I didn't care to be in the OR.
But PAs can be in the operating room.
PAs definitely can. We have some dedicated PAs who work only in the OR. For me, I sort of like to think of myself as a hospitalist for neurosurgical patients. I get to manage their pre and post-op courses in the hospital, which can include just basic care of medical conditions that they may already come in with, such as diabetes, hypertension, that sort of thing, to the very nitty-gritty neurosurgery specific things like cerebral spinal fluid leaks, brain tumors, and those areas include procedures such as lumbar punctures and removal of surgical drains and that sort of thing. So I feel like I have a good variety of what I'm doing.
Okay. So what other procedures do PAs do in neurosurgery? You mentioned a couple of them.
So it depends on the population that I'm working with. My role lets me treat different services, different patient populations. So if I'm working with the pediatric population, a lot of it will be reprogramming shunts, doing ventriculoperitoneal shunts for treating hydrocephalus. It will be removal of surgical drains, such as external ventricular drains or subdural drains. And then, occasionally we do the lumbar puncture on a pediatric patient. So it's just there's a huge variety that we can do with those folks. For vascular patients, so those who've had strokes or brain bleeds, sometimes we inject TPA into
That's a blood thinner.
A blood thinner, yeah, into drains that are going into their brain to help break up blood clot. That's always very scary because you could make something worse. We do lumbar drains, so we insert a drain into the back similar to how you would do a lumbar puncture, and then you thread a catheter in and take off spinal fluid little by little to see if that helps. That can be used for a handful of different conditions, things like normal pressure hydrocephalus, spinal fluid leak.
And then you also tap baby's fontanelles, like directly when you cannot put a drain.
Yes, yeah. When we can't put a shunt in when they're too little, we sometimes put a disc called a reservoir, and we will tap that on kind of a scheduled basis to help relieve that pressure that's coming from the excess production or lack of drainage of spinal fluid.
So even if you're not in the operating room, you still have a lot of bedside procedures you do.
Yes.
Invasive procedures.
Invasive, yeah.
That's pretty interesting.
Mm-hmm.
What do you enjoy most about being a PA in neurosurgery? Or in general being a PA?
I just think medicine is really cool. I think that the fact that I get to be a part of this field that is always advancing, and you're getting to do amazing things for people, and you get to see in real time helping someone, and sometimes it's not just the medicine, it's the just being a person and working with other people and bringing comfort to them. I think that it's a good mix of science and what it is to be a part of humanity.
Interesting, well put. How do you stay current with all the advances that are happening in surgery and in medicine?
Well, I think I luck out a little bit working for the Duke system because we have lots of opportunities for continued education. We have a neurosurgery grand rounds weekly, so that's 2 hours a week of just learning about the advancements and kind of what's happening in neurosurgery or medicine as a whole. We do a morning report every morning with the medicine residents, the neurosurgery residents that we work with, where we talk about cases that were interesting. So I think just being in the healthcare system that I am in, I have a lot of that at my disposal.
Other than clinical aspects of your profession and your work, what are the things you enjoy most about being a PA? What else do you do?
So we get the opportunity to do a lot of teaching, which I've come to love, especially as I get more comfortable and confident in my role. We do a lot of training for the PA students as well as the MD interns that come in to the neurosurgery team. We get to teach them how to do procedures. The residents come through and then they move on to their future careers. We sort of are constant in the service, and so there's always new residents that need to be taught things, and we've been there. We get to do that. We do training for nursing staff as well. A lot of the stuff that we're asking of nurses to monitor and manage are really specific to neurosurgery, so we like to give in-services and things to give them enough information about how they can feel confident taking care of our patients.
It's interesting that you do teach MD residents and future surgeons in their journey to becoming a surgeon. Interesting. So, can you describe your typical day as a PA?
So for my job specifically, we have early hours. That's just the nature of being on surgical service. So I come in at 5:30. I get my list of patients for the day. I round with my team, where we see all of our patients, do our exams, and then we develop our plan for them for the day. And at that point, we sign out to our attending physicians, the surgeons that are managing those patients, and make sure that our plans are what they're wanting us to do. At that point, the residents go off to the OR to get their surgical experience, and I am on the floor, with my list of tasks to carry out for the day. So at that point, I decide, what do I need to do to most effectively manage my day? And so then a lot of it will be getting the patients discharged that need to be discharged, going to multidisciplinary rounds, getting procedures done on the floor that need to get done that day, consulting the appropriate services for different patients, updating the families, which it can take a lot of time depending on what you're working with. And then towards the afternoon is when I've sort of dedicated my time. If my day has gone smoothly, I can dedicate my time to getting my documentation done. Now that being said, I'm also there to put out fires. So I carry around a pager, if you can believe that we still use those, and I'll get a page that a patient is seizing or a patient is having an exam change and they need to be run down to CT, or very infrequently we'll have codes or RRTs, and so I'm the person that's responsible to be there, to handle that and to make sure that the appropriate things happen when they need to happen. So that part is kind of keeps the day exciting.
One of the hallmarks of the profession that attracted me to it also that you spend more time with the patients compared to doctors, just because the way the tasks are arranged. Patients' conditions change acutely and dramatically and in a fast pace as well. So you get a plan for the day in the morning, right? But what if the patient's condition changes after the plan? The surgeon has told you, okay, this is what I want done for the day or for this patient, but you're in the front line and you're seeing the patient constantly when they're not there. And what if the patient condition changes? Do you have autonomy to make decisions on your own? Talk to me about that.
So I think that the autonomy comes as your surgeon trusts you more and knows you more. And so I feel when I first started in neurosurgery, I didn't feel like I had a lot of autonomy. I had a lot of support. And you are treating sick patients, so you're not working in a vacuum. You shouldn't be ordering CT scans on someone without letting your surgeon know that that's what you're going to do, because they're the one that is going to have to take them to the OR if something shows up on that scan. So everybody needs to be in constant communication, and I like that about the hospital role. That being said, now if I can't get a hold of my surgeon or my chief resident and something is happening, I do feel like I have the autonomy to say, okay, we're taking them down for a scan right now, we're giving them this anti-seizure medication, XYZ, and all the while making sure that I'm trying to get a hold of the people that need to know that this is actively going on. But I feel the autonomy to make those decisions in the fast term.
It comes with experience as well.
Yes.
And the longer you're within a team, the more experience you get and the more they trust you.
Absolutely.
I do believe that PAs can function at a very high level of autonomy to the maximum to the license, but it also comes with experience, and trust is always earned in healthcare. Nobody gives it to you, but PAs do practice at a very high level of autonomy and independence in their practice.
Yeah, and I mean, to that point, the residents have to let the attending know if they're taking someone for a scan. It's not a situation where that bodes for the residents as well, the doctors as well. Everybody needs to know what's going on if there's something happening with a patient. It's just whoever is there on the front line to make those things happen, to get the patient to where they need to be.
Healthcare has evolved into not a one-man show. It does take a village to get a patient to the hospital, through the surgery, and out of the hospital. Neurosurgery doesn't stop in the OR. You take care of patients before, you get them ready for the surgery, you help PAs help them in the OR, and PAs help them get the patient out of the hospital as well. That's very interesting. The breadth of scope of practice is amazing. And like I said before, healthcare is now a team-based approach, and PAs are a very integral part of the team. What advice would you give to people or anybody out there thinking about the career or wanting to become a PA, whether it's a new undergrad or was it somebody seasoned like you who's going to change their career?
I think it is so important to shadow and to see if it is something that you want to put yourself through. It's not an easy career path as far as the education process goes. It's not necessarily an easy job. It's a hard job, so you have to know, is this going to be a fit for me? Is this what I want to do? Because you could be a bad PA, and you don't want to be a bad PA. So you can struggle through it, but is that worth doing? And then I think if it does seem like something that you want to do, start with those prereqs and those classes, and figure out a good way for you to study and approach the educational aspect of it, because it is challenging, and we do see people who fall out of the program because it is so rigorous and so fast-paced.
Those are the people who have not done their homework. They just think that, I can become an MD, let me become a PA, or they just talk to a student counselor to figure out what is the best job out there, what gives job security, which pays well. If you're choosing a profession based on those are the ones who are going to get disappointed. Either they're not drop out in the middle, figuring out that it is intense and it is hard, or they get burned out very quickly when they start a career because it is intense and it is hard, and not just a glamorous lifestyle or a paycheck.
Right.
Interesting. So any new grad looking into PA profession should do their homework.
Definitely.
Let's now talk to people who already have a career in healthcare or any other field, and now wanting to say, okay, you know what, I want to go into medicine. You certainly can speak on experience. I was a physical therapist for 10 years, and I didn't get burned out, but I also wanted to do more than what I was doing within my practice as a PA. I wanted to be more involved in the medicine aspect and not just in the rehab aspect. That propelled me into PA school. It wasn't easy, it was hard, but it's doable.
Right.
Can you talk to people who are in a different career? Mine was a midlife crisis. Talk to them about how it is possible, but what advice would you give them?
I think at that point, if you are looking to make a full transition in your career path, whether you have healthcare experience or you have none, it's going to be really important to have a really good support system. We touched on earlier, my husband was all for that, and he was supportive of that. So I was able to pursue this and continue to build my life outside of work. And so I think that having a support system, having people who understand what you're doing is hard, and then just knowing that the schooling does end eventually. You will get through it if it's something that you want to get through.
And now you're working as a PA, and you're mom of two. You have two boys.
Yes.
What are their names?
Miles and Luca.
How old are they?
Miles is 7 months and Luca is 3.
Okay. And how is it now working as a PA with two young children? Is it challenging? Is it manageable?
It's very challenging. I think when I just had the one, it was much more manageable. I am now trying to figure out a good balance with the two, but I have a really amazing group of people that I work with who make it possible for me to figure it out, and I don't always do a good job or have it all, figured out, but my network of people that I work with are amazing in making it possible for me to be able to do both.
How is it at home? Is your husband supportive of you continue to work after 2 kids?
Yes, he is. I mean, at this point, I don't think that we could. I don't know what family can be a one income family, but I mean, people do it. But yeah.
That is true. Its cost of living is high.
Yeah.
Especially if you're educated and you have the strength, have the knowledge. It's a waste if you don't use your brains and to help people. And
right.
So you have 2 boys, and your mom, a woman. A lot of chatter about women should be homemakers and stay home. And what advice would you give to your future son who hears things in social media or growing up that women should be homemakers and stay home and not work? You're a working woman, a mom, a wife, and a great clinician as well. What would you tell to future daughters and future sons?
So this is such a complex question and very multifaceted. I think the first thing I want to say is that if a woman feels that her calling is to be a homemaker and a stay-at-home mom, I have no disrespect for that. My mom did that. I think it's a wonderful thing. I think it's a hard thing to do. So that being said, I think it's important to recognize that in and of itself. When I talk to my sons, or when I talk to them in the future, I guess, I think that to not support women to pursue their passions and their gifts and talents and what drives them is really ignoring a wealth of resources that can help society as a whole. I think that, the women who have come before me, who have made it possible for me to do the job that I do, had to have so much strength and grit and determination and tenacity in the face of kind of going against societal norms. And those are the people that you want on your team. Those are the people that you want to help progress society forward. So to ignore that would be such a shame and such a waste. And I think that, in response to certain people who say to the contrary in public forum or whatnot, I think it is very unrealistic in this day and age to expect people to work, to be single income homes at this point, unless you are making NFL money for kicking a ball. And I would never want my sons to feel that they have the right to push an agenda and make a generalization on a group of people who have so much more to offer if that's what they feel is their calling.
Well said. Well put. Well, Rachel, thanks for coming on, sharing your experience and your journey. Wish you the best.
Thank you.
And good luck to you.
Thank you.